patient, and I think that that expectation is best demonstrated. And so the patient will be seated in a chair. Usually we have other equipment around. Prior to the patient coming to the chair, certainly I advocate checking the blood sugar level, the blood pressure level, and certainly the eye pressure as well, the intraocular pressure. The blood sugar level, because we want to know the state of the patient's control, and this may impact on the patient's vision when the patient sits before you. The blood pressure level, because if the blood pressure is out of control, then not only would the eye problems accelerate, but the patient may not be able to receive a dilation. Dilation is making the pupil larger so we can see the retina properly. And some of these drops used for the dilation process can actually elevate the blood pressure further. And the eye pressure or intraocular pressure, which is normally or commonly known to be a glaucoma test. But if the pressure in the eye is elevated, then the dilation may also be a risky activity to conduct with the patient. So we need to know this. So the patient sits in the chair, has a visual acuity done on a chart similar to the one projected on the screen, and so we can determine what the vision level is. Normal vision is 20/20, meaning that what a normal person is expected to see at 20 feet away, the patient sees. Vision that is impaired, we check it in one eye then the next, and we do so by the use of an occluder. So the patient's eye is occluded, one then the next, to do the vision. And if the patient wears spectacles, certainly this should be done with the spectacles on. What else the patient can expect? They will be examined at a slit lamp, which is a microscope, which is this device. And this will show me events happening at the front of the eye, on the surface of the eye, in the lens of the eye, and also in the retina. And it's simply a microscope. Okay, so it carries a light, and also we can use lenses to view the retina through the pupil at this device, and it's very, very important information. The patient will be dilated in most cases, and dilation means you are putting eye drops to expand the pupil so the visibility can be clearer. Therefore, the patient's vision at the end of this examination will be blurred or impaired somewhat, temporarily for 2 hours, and therefore the patient is asked to be accompanied most times for this examination. Also, if the patient drives, the patient is asked not to drive for that visit if he or she is not accompanied. I'm going to go back. So the patient has to be laid back somewhat so that we can have access to visibility of the full extent of the retina all the way to what we call the aura. And so if we focus here on this chart, this equipment I have wearing on my head, we call the hat, allows us to see all the way back here, the nerve of the eye, the blood vessels in the retina, all along through what we call the vitreous cavity, because if there's hemorrhage or sometimes scarring, this is where it will show itself, and therefore we take the instrument to have visibility through the lens of the eye, all the way to where you call the aura, which is to the edge of the retina. You can also expect exposure to some bright lights, and an indirect ophthalmoscope is used to just view the patient's retina, right? And look at me. So when this examination is complete, the doctor will have pretty much a clear idea of what is happening to the state of the diabetes, the effect of the diabetes on the eye, and the effect of the diabetes also on places like the brain and the kidneys, because what happens in the eye usually mirrors what is happening elsewhere in the body. What we do here is provide the patients with other tools that will assist us in planning for the patient's further care. And those tools include the OCT, optical coherence tomography, which shows you deeper structures, cross sections of the retina, and even deeper than that, structures that I cannot see with any of the instruments in here. I also do photography because that helps to keep track of the patient's progress. And certainly, in the case where the patient is referred by a general practitioner or an internist, then here we anticipate that we can put together a proper report, including photographs and scan images to send to the internist or the practitioner. And so what we use is just technological tools available to us because this is 2016 and therefore we have to be up to date with what's happening.